Dr. Victoria M.A. I'm a plastic surgeon in Scottsdale, Arizona. Today I'm going to chat with you a little bit about implants flipping. What does that mean? How can we tell if they're flipped, and what do we do about it? So we'll use this implant right here as an example. This is a smooth, round silicone implant. It is of a higher profile variety. So what do we mean by flipping? So it's totally common for the implant to rotate in the pocket. However, an implant flipping is when the front projected or rounded side and the back flat side change places. So that the flat side is now facing forward. So patients will often come in and they'll tell me they just don't feel the same. They might say, I can feel this little ridge right here. Sometimes you can actually see it on a thin patient. It will look flat compared to the other implant. Typically patients will just say, something's not quite right. I don't know exactly when it happened. It might have happened during sleep, but something is just a little off on it. Why does this happen? Oftentimes this happens because the pocket around the implant is just a little bit too big. When we make an implant pocket anywhere on the body, we want that pocket to fit very snugly around the implant, just like a hand in a glove. But if that pocket gets a little too big, it gives a little bit too much room for the implant to flip over. More common with a higher projecting implant. It's more common if the implant is in front of the muscle than behind the muscle. It's more obvious if the implant is form stable. So these are the newer implants, gummy bear implants, if you will. And that's because if this implant flips over, it will still hold that shape. Those are usually the reasons that we see it. What do we do about it? Typically, the best thing to do is to take the patient to the operating room. We go in there, remove the implant, usually confirm at that time that the implant was upside down. We're going to tighten up the pocket so that it fits the implant better. That is also the time to switch out the implant if you want a different size, projection, etc. Sometimes we will change the plane that the implant is in, basically in front of the muscle to behind the muscle or vice versa. And it just depends. The other thing that can be done is we can try to flip this over in the clinic through the skin. The reason that I don't particularly like that option is that it's very prone to flipping over again. So really my recommendation is if you feel like you have an implant that is flipped over and the flat side is facing forward, I would recommend you see your plastic surgeon or a plastic surgeon to have it evaluated and flip that implant back in the right direction. Hopefully that gives you some insight to implants flipping. If you have any questions or comments, drop them below.